Smailes. I'm a doctor and I work in the UK, and I'm a board member for Trent Accreditation scheme. I'll tell you a little bit about Trent. Trent Accreditation is an NHS UK accreditation scheme, and we've been going since 1993 in the UK. Mainly in UK hospitals until '99, and then we've worked internationally since that time. We started working in small community hospitals in the UK that had no quality programmes. The larger hospitals had quality programmes, but the isolated small hospitals really didn't have anything to cover them. So we developed standards, and that was using guidelines from the Department of Health, from the Royal Colleges, and those guidelines have been developed over the years and now are international standards. So started in 1993, that was in the UK. In small community hospitals in the UK. Since '99 we've worked internationally, starting in Hong Kong, and more recently we've moved into other countries and other areas. So we provide accreditation of hospitals and of clinics and of daycare units. That's looking at the quality of the whole organisation. So the medical care, it's patient-centred, so anything that affects the patient we'll be looking at. So that'll be the management of the hospital, the care on the wards, how the receptionists greet them, everything in the whole process of the care of the patient. Accreditation obviously is a way of looking at quality within the hospital, so it's an external review of quality in the hospital. And lots of people are offering that. There are several schemes offering accreditation. Trent is one of those. We do that in perhaps a slightly different way from other schemes, and I can tell you more about that if you wish. Trent is known as a UK NHS brand. So going to an accredited hospital means you know that hospital has had an external review of quality. You know that someone has been in, looked at all the processes in that hospital, and if they pass the accreditation, that's a safe hospital, or as safe as it can be. Risk has been minimised in that hospital. Trent provides the UK branding, and it's an NHS body which provides some credibility to the accreditation scheme. All accreditation schemes are going to provide some similar services. JCI and Trent both provide similar services in terms of quality accreditation, but deliver it in a different way. And I think really it depends on the organisation, on the hospital, as to which is the best scheme for them. There's no right scheme for everyone. I think it's a matter of choosing which is the best for your particular organisation. The way Trent works is a developmental scheme. So we will initially do a visit to the hospital, meet with you, see if we can work together. If it looks as if we can, we'll look at the standards together. We don't impose our ways of working. We don't say, these are the standards you must work to. We look at those standards, and if there are areas that perhaps aren't appropriate in your particular country, we look at them and see if we can tailor them to be culturally sensitive to your particular culture, hospital and country. Following that, there'll be a self-assessment process, and if the hospital decides they're ready for accreditation, a surveying team will come to the hospital. All our surveyors are employed by the NHS. We have no full-time paid surveyors, so they're bringing with them experience, up-to-date clinical experience. We have doctors, we have nurses, managers, pharmacists. A whole multidisciplinary team will come to the hospital. Perhaps a different thing that Trent offers is training for local surveyors. So we will have the UK surveyors come, but also if hospitals feel they want this facility, we'll have surveyors from that country come to the UK and learn about the way Trent works, so that we can have people in post who know about the scheme, they know about quality, which will help to foster the quality culture within the hospital. And we find that an incredibly powerful way of championing quality and actually making it part of the way people work on an everyday basis. Yeah, we're a member of ISQA, and it's currently under review whether or not we actually go ahead with the ISQA accreditation of our scheme. We've discussed this long and hard. We're part of the NHS, so as part of that we have quality control. All our standards are developed from the Department of Health, from NICE, which is our clinical excellence standards, and from the Royal Colleges, and we've had local reviews of accreditation standards. We're also a member of UCAF, which is the UK Accreditation Forum. So we feel that we are actually looked at from several bodies at the moment, However, it seems that ISQA perhaps internationally would perhaps make us more understandable. So for that reason alone really, we're deciding whether or not to apply for ISQA accreditation. Why not? Cost, really. We are a low-cost accreditation scheme. Because our surveyors are already paid by the NHS, we don't have to pay salaries to surveyors, which makes us a very affordable scheme, which means we can offer accreditation to lots of organisations who find the higher cost schemes prohibitive. If we do ISQA, it's a fairly expensive process, and of course because we're not-for-profit, we haven't got a budget, we'd have to pass that cost on to organisations who are accredited by us. So if we want to keep this a low-cost scheme, we try to minimise any costs that we actually incur. And as we feel without ISQA, we're still a safe accreditation scheme. Really, it would be almost as a marketing tool that we took ISQA rather than as a safety tool.